In this video, Kenzie and I are going to show you 4 techniques you can do if you're having low back pain. First thing we're going to work on are stretches of the hamstrings, the calf muscle, kind of stretching that everything on the back side of her lower extremity. You're going to feel a pull in the back, just relieve some of that tension in that area as well. So you can bring the leg all the way up and then work on bending the foot back, what's called dorsiflexion. If you don't have someone that can do this to you or help you with, you can use a towel or you can use a sheet or something to pull your leg up. You can use those stretch out straps. Those work really well. If that's too much to do that with a knee straight, you can do it with a knee bent. So Kenzie's just going to bend her knee. She's going to pull her own knee up, kind of pull it and hold in that position. You would hold that somewhere between 15 to 30 seconds and repeat that several times a day. This movement is going to be a curl up, so you're going to lie flat on your back. What Kenzie's working on is kind of sliding her hands down the mat here. If you're on the floor, you're sliding your hands towards your feet, curling up in your middle back, kind of rounding that area, flexing the neck forwards. You repeat that for 15 to 20 repetitions several times a day. This exercise is going to be a prone press up, so you're working on in-range loading with this, really increasing that curve in the lumbar spine. You're going to look up at the end, hold that somewhere between 2 to 5 seconds, and then go back down. Push yourself back up, do that same technique. If you have a lot of arthritis or facet irritations, stenosis in the lumbar spine, this exercise may not be the best option. It may increase your pain and symptoms, so just stick with that curl up movement that we just showed you prior to this one. Our last movement is going to be a prone lumbar traction. I like this technique. A lot of people do traction with a patient on their back and supine. I just like this because I think it's really easy and it works really well. You can put a pillow under the patient's pelvis if you want to kind of create more of an arch here. But in this case, we're just going to go without the pillow. I'm going to put one hand right at the top of Kenzie's sacrum here. I'm pushing down into the mat. My other hand is going to go right at the bottom of her thoracic spine here. And I'm going to push. I'm kind of crisscrossing my hands in this position, holding that force. I can sustain that force. I can oscillate or kind of bounce with that. Another technique with this you can use is also your forearm. So I take one forearm here, and I'm working on kind of spreading apart my forearms and my elbows, kind of using body weight, leaning in, just creating that traction stretch in that area. You can also combine that with a little soft tissue work or massage. You can use one of those massage guns, those different things in that area to try to modulate the tone and decrease the pain so that you can perform your exercises and stretches. Thank you so much for watching. We hope this video helps to reduce that low back pain that you may be having.